Greeting from Cameroon. My name is Elundombede Jodine Roland, PhD student at the University of Yaoundé 1, Cameroon. I'm a founder of My-BeatNTDs-Assistant. My-BeatNTDs-Assistant is a young startup under creation, currently hosted in the Center for Schistosomiasis and Parasitology of Lake Cameroon, with the aim to design digital solutions to support the control and the elimination efforts of entities in Africa. Our team is a group of young researchers with more than 5 years of experience in the control and elimination of entities in Cameroon. Schistosomiasis, Lymphatic Filariasis, Onchocerciasis, and Buruli Ulcer are 4 neglected tropical diseases affecting several million of people in Africa. However, the diagnosis and the treatment delay, the lack of the continued and effective follow-up of control interventions, the lack of health education and health training, and most importantly, the lack of the community ownership of control programs greatly hinder the control and elimination efforts of those diseases, particularly in the area difficult to access. Our proposed solution is a mobile application connecting community members, community health workers, control programs, and entity organizations to redesigning the management of individuals infected or at risk of infection for those diseases in Africa by allowing them to early know and improve their infection status, accelerating their contact with healthcare providers, and facilitating the implementation and the sustainability of the community-based or individual-based health interventions. To do this, we aim to empower community members, community health workers, healthcare providers, entity organizations, and control programs with improved health care, health education, health communication, and health training tools to reduce the disability and the negative social impact of entities and to sustain the positive health outcomes gained after health interventions. Indeed, community members will be able to early know their infection status through cell-based diagnosis using an evidence-based scoring method and early treated by connecting them with healthcare providers. Community health workers and healthcare providers will be able to provide more efficient and timely healthcare, health coaching to improve and sustain the health outcomes and build healthy habits in their communities. Control programs and entities organizations will be connected early with at-risk or infected populations to provide more efficient healthcare, health education, and health training. In resume, our solution will enable the presumptive diagnosis, the early access to control programs and entities organizations, the personalized and community-based health education, and the evidence-based training. Those activities will enable us to reach our 3 outcomes, which are the improvement of the quality of healthcare services and facilities, the enhancement of the promotion of health education and health promotion, and the expansion of the sustainability of control programs. As part of this project, we will collaborate with national control programs, research centers, and non-governmental organizations working on those entities by requesting their mentorship, their technical assistance, and the data necessary to design, implement, evaluate the success, and improve our solution. Also, we will have a regular meeting to give them the feedback at all the stages of the project. We are a group of young researchers, including biologists, social scientists, public health actors, epidemiologists, and computer engineers with an important background and experience in the control of entities in Cameroon. We envision an African continent free from disabilities and the negative social impacts of entities, and where every person is actively involved in the battle. So our team has the necessary skills, the enthusiasm, and the mentorship to achieve this challenge.